If you are thinking about going on Accutane, currently on Accutane, or if you just want to know more about Accutane, then cheers, you have stumbled upon the right video. My name is Zoe and I'm almost 2 months into Accutane. So in this video, I'm going to be sharing what I think you should know before Accutane, what I wish I knew before Accutane, and all about my current journey with Accutane. So if you're interested in that, then keep on watching. Before we get started, I just want to say that I myself am not a dermatologist, I'm not a skincare expert, but I am a skincare junkie. So in this video, I'm just sharing my personal experience and journey with Accutane. So always make sure to do your research. I did a lot of research here on YouTube, Google. I talked to a few dermatologists, so make sure you do that before you decide that Accutane is right for you. Before we dive into what you need to know before starting Accutane, I'll just give a little bit about my personal experience with acne. So I got acne as a teen, pretty much when a lot of people get it, like 13. And I thought, when I'm an adult, it's gonna go away and I'll be totally fine. And here I am as a 24-year-old adult with acne. Currently, while filming this, we're in the coronavirus pandemic, and a lot of my acne has been because of this current pandemic. I would say that my skin was like 80% clear beforehand, and now it is all over the place. So I decided that Accutane would be the right thing for me to do. I am currently working from home, so I don't have to put on makeup every single day. So I thought it was the perfect timing. I had a little bit of downtime and I could commit to doing Accutane. I have been told by dermatologists in the past that Accutane was an option for me, but one of the reasons I had never done it before was because of the extreme list of side effects. By the way, if you're wondering, I'm not wearing any makeup right now. I did do my morning skincare routine, but this is what my skin looks like currently 2 months into Accutane. I am gonna start a little playlist here on YouTube of my entire Accutane journey. So I'm gonna be posting before pictures, after pictures, hopefully, fingers crossed, they are good. And I'll be sharing all of that. So make sure that subscribe button down below so you can see when I do upload new videos on Accutane, and check out that playlist. So Accutane is really just the brand name, but isotretinoin is what it is actually called. That's like the drug name. This is what some of them look like when you receive it. So you have all of these warnings. You'll see this little pregnant woman with a big cross over her. Literally the side effects, I mean, this is just like one of the little sheets that you'll get. The side effects go on and on and on. And for someone like me, when I was younger, they were really, really scary. A major thing about isotretinoin or Accutane is that it can cause major birth defects. So you have to be really, really careful if you're currently sexually active. They talk to you about being on 2 different forms of birth control. So you either have to be on like the pill and use male latex condoms, or be on like the NuvaRing and use male latex condoms, or abstinence. So that is one thing to think about. If you currently have a partner, you might want to talk to him or her about it before starting Accutane. One of the things to also know before starting is that you will have to get your blood drawn every single month. This was one of the things that I had no clue about. I don't know like why I had never heard of it before. In all my research, I really didn't know until I went to the dermatologist's office, and she was like, okay, here's your first blood form. Like, you're gonna have to get blood drawn every month. So that is one thing to think about, where your closest place is to get blood drawn. How convenient is that for you? Because you are gonna be having to go and get blood drawn every single month. Another thing is that you do have to have monthly dermatologist appointments. So you are committing to 2 things every single month. One is going and getting blood drawn a little bit before your appointment, and then 2 is going and seeing the dermatologist every month. So they're only going to give you 1 month of prescriptions at a time, and then you have to go back in, see your dermatologist, check in, and then they'll give you the second month. Every single time you check in with your dermatologist, they're also going to make you pee in a cup to do a little pregnancy test. This is just one of the forms that they're making sure that you're being safe, you're currently not pregnant, and if you are pregnant, they will have to talk to you about going off the medication, because you cannot continue it if you are pregnant. When I first started Accutane, I was on 40 milligrams 1 time a day, and you have to make sure you are taking it every single day. It is really important. So if you're someone that is bad at pills or taking your medications, maybe try to come up with some type of system, or talk to your doctor and see if Accutane maybe isn't right for you then. Right now, I'm taking 60 milligrams, so it's 30 milligrams twice a day. So I have to remember to take this medication in the morning and at night. And as someone who was not used to taking medications before, it's definitely an adjustment. I set like a little notification on my phone so that I get notified when it is time to take my medicine. But if you're someone that thinks you're gonna forget to take it, Accutane might not be right for you. Accutane is not 100% guaranteed. I believe it is 95% effective, don't quote me on that, but there is a chance that you could go through this 6-9 month cycle of medication, all the side effects, and then it doesn't work. So that's one of the things to consider with your doctor. It is not a 100% chance you will be completely acne free afterwards. It is very likely that it'll work, but for some people it doesn't. So it would be super devastating. I know for myself personally, if I do reach the end of my journey and my skin is not clear and it didn't work, it's like you went through this entire battle for nothing. So definitely check in with your doctor to see how effective they think it'll be right for you. A few of the side effects that I currently have or have had in the past, the first one just being extremely dry skin. You could probably see my lip is completely split here. Now when I go to eat food, like a burger or something big, like I can't even open my mouth that wide without the corner of my mouth splitting. My lips are crazy dry. My skin is dry. I'm peeling everywhere. I definitely broke out a lot more. So the isotretinoin kind of makes everything come to the surface. So I had 300 breakouts all at once. That was definitely not fun. If you have like any type of event or something coming up, you might want to work on timing that with when you are starting your Accutane, because it is likely that your skin will get worse before it gets better. So right now I'm in the phase where my skin is getting worse and it's kind of hard to see like the light at the end of the tunnel, but I'm hoping it is there and that we will get in the clear soon. I did have 2 nosebleeds. So nosebleeds are something that's really common because everything is kind of dry. So your nose is really dry on the inside. So I had 2 nosebleeds that were pretty severe, nothing totally like dangerous, but that is something to keep in mind. Now I just carry like a mini pack of tissues with me wherever I go, just in case I do get a nosebleed again. One of the benefits, it's a side effect, but it's also kind of a benefit, is that your hair does not get greasy at all. So before I'd have to wash my hair like every day, maybe every other day, and my roots would get super greasy. And now I could probably go like a full week and my hair will still not be greasy. So you don't really have to wash your hair as much because it is super dry. Another thing is that I literally feel like an 80-year-old woman because my joints hurt. I've never really experienced joint pain before, but now like my knees hurt a little bit. It's like when I wake up in the morning it hurts, and that is another one of the side effects that affects some people and not others, but that is something that is totally different to me, and I was like, I don't even know what this feels like. Accutane is also a major time commitment, so my dermatologist told me it could take anywhere from 5 to 9 months. That can vary, and also some people need 2 rounds. So some people finish a first round of Accutane, they do a full 9 months, and then like a year later they need another round of Accutane. So hopefully that doesn't happen for me. Again, this is just like what I think you should know before starting, what I wish I knew before starting, but this is no means like all about Accutane, so I will have more on that once I finish and once I have more knowledge about how it directly affected my skin. But some people do need that second run of it, and 9 months is a really long time, so it is a long commitment. So definitely like take a look at your calendar, map it out, and see what is going on. Also, right now it is currently like the dead of winter, but if you are taking it over the course of this summer, Accutane makes you really sensitive to the sun. You should always be wearing SPF, but especially on Accutane, you really can't be in the sun. You're prone to getting sunburn and your skin is just really sensitive. I feel like I've been talking forever. If you guys have any questions, I'll try to answer all of them in the comments down below, but that is going to be it for this video. Again, I'm gonna have that playlist. Make sure you hit that subscribe button down below. Thank you guys so much for watching. If you are thinking about going on Accutane or currently on it, I hope this was helpful in some way, shape, or form. Again, just leave a comment if you have any other questions. Hit me up. I'll try to answer all of them as best I can, and I'll see you guys in the next video.